The quality of HIV care in Uganda is generally good according to a study done in 2011 by the Institute for Health Metrics and Evaluation in collaboration with the Infectious Diseases Research Collaboration.
The numbers are increasing over time, which may also lead the government to look at better ways of increasing the resources to ensure that all these numbers are treated well.
To understand how well the HIV patients were responding to treatment, the research team used the viral load outcome method.
Over 87% of the patients that we found at the facility were responding well to the treatment.
The virus load in the patients was suppressed. It had reduced, which also helps reduce on their infectivity rate, according to prior research. For this reason, the report recommends that viral load should be used in monitoring treatment in HIV patients, something backed by WHO in 2013.
The use of viral load to monitor patient outcome on ARVs is very important. This is coming ahead of what we were planning.
The Director General in the Ministry of Health says that the challenge is in not having equipment to measure the viral load in the face of a relatively large number of CD4 count machines.
We are looking at having a central laboratory at CPHL where we can collect blood and bring them for assessment of viral load.
The report, however, noticed that there is huge disparity in costs while providing antiretroviral treatment. Although antiretroviral treatment is improving and the number of beneficiaries to double in the next 2 years, the costs are relatively high, especially in private hospitals. The projected annual average cost of treating a new patient, inclusive of antiretroviral drugs, ARVs, was at 460,000 shillings at health center tools, up to 800,000 in private hospitals. Compared to other countries with antiretroviral drug costs included, Ugandan facilities had a higher projected annual cost per patient at a little over 500,000 compared to Kenyan facilities at 486,000. Also, ARV costs accounted for a larger proportion. Projected annual antiretroviral therapy expenditures for Ugandan facilities standing at 72%, Kenya at 69% and Zambia at 60%. The report also takes note of the continued neglect of looking at non-communicable diseases, especially heart disease and diabetes, yet these are on the rise in the country in districts like Kampala and Wakiso. Most health facilities are more prepared to diagnose and treat infectious diseases.
There's opportunities to improve some of the supplies and equipment at some of the lower levels in the health system. And the goal is to have a better understanding of what health systems are actually producing in terms of medical care, what's the sort of quality of what's produced, and what are some of the opportunities for improving health services.
Dr. Jenna Chan, the principal investigator for the study, says that patients were generally happy about the services provided.
However, many of them noted concerns about the delay in getting care after presentation to the facility.
The report commends the government on fighting malaria, as most facilities were found to have rapid diagnostic tests and treatment capacity. Although infrastructure is good, gaps still remain, with lower health centers having low access to power and improved water sources. Florence Naluyimba, NTV.